If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to Ask the Doctor. It's great to be with you today. As you know, this program was created to assist you in understanding medical issues so you can take charge of your own health. It's more important than ever to become an informed patient, and we are here to bring you timely health discussions. Now, for those who are new to the show, there are two ways to get your questions in. First, by calling our live phone line at 718-499-6101. Second, and I've been getting a lot of these lately, email us your questions to askthedoctor@netny.net, and we're going to bring them into tonight's discussion. Now, for this night's episode, we have Dr. Margarita Kutsina, a geriatric medicine and internal medicine attending at New York Methodist Hospital. Dr. Richard Lazaro, Chief of Thoracic Surgery at New York Methodist Hospital and a general surgeon as well. And Dr. Bruce Garner, Chief of Rheumatology at the Lutheran Medical Center. And welcome to all of you. And we have a great show tonight. We have Dr. Lazaro, who's new to the net, first time, but we're looking forward to having him here, and two return guests, Dr. Bruce Garner, Dr. Kutsina. And we're really excited about this. But first, let's get to the news and see what's happening. We found a few stories this week. One, the big breakfast myth. And they used to tell us, you know, eat a big breakfast and it's going to help you lose weight because you're going to eat less for the rest of the day. And they studied it to see if that's true. And what they found out, you eat a big breakfast, you're going to probably eat a big lunch and dinner, and you're going to gain weight. So there was no benefit to eating a big breakfast. Actually, you could lose weight by cutting down on your breakfast, which goes against what your mother was telling you, have a good breakfast. It's the meal of the day, makes you... Anyway, sorry, there goes one of those myths. Eat a breakfast, but make sure it's a healthful one with few calories and the right kind of foods. Okay? Now, second, there was a study that really is not a groundbreaking study, but it helps to solidify what we've known. Now, a lot of people at this time with the cold going around, they're put on antibiotics because they demand it sometitimes. I want my Z-Pak, I want my erythromycin. And what happens is a lot of these people, particularly the elderly, are on blood pressure pills. And they take the erythromycin with a blood pressure pill, and the blood pressure pill works 10 times as well, and your blood pressure goes down to next to nothing, and you have to be admitted to the hospital with shock or very low blood pressure. And it happened a significant amount of time. So this study quantified the effect of the blood pressure pill on these common antibiotics, erythromycin and clarithromycin. Incidentally, the Z-Pak did not seem to have the effect on the blood pressure pill, which calcium channel blockers the blood pressure pill, Norvasc, diltiazem, common pills. So you want to ask your doctor, if you're on one of these calcium channel pills, you don't want to take certain types of antibiotics, and erythromycin and clarithromycin are the two biggest offenders. Now, another study that came out that showed that not a good match was atrial fibrillation and alcohol. I mean, how many times do you hear 1 or 2 drinks a day? That's great for you. It helps for cardiac health and helps to prevent against heart attacks. The problem is that it had like about a 300% increase with atrial fibrillation, people who drank a couple of drinks a day. And then as it went up, there was almost a linear relationship. As you drank more, you had increased episodes of atrial fibrillation, either first episode or repeated episodes. So people who've had atrial fibrillation, we've seen that a lot. We've gotten a lot of calls to this show with atrial fibrillation. You want to try and avoid alcohol. There is no safe level. And for women, probably even 1 drink may be too much. So be careful. I see brittle bones, and I guess Dr. Bruce Garner will be talking about this later on. We need to look earlier. We can't just wait till the woman is 65 years old, but there are people who have risk factors for osteoporosis, brittle bones, that you can pick up in their 30s and 40s that you don't want to wait because the first episode of osteoporosis may be a fracture. And in a lifetime, 50% of women will have a fracture related to osteoporosis. So it's a serious disease. Good news is there are ways to treat it, things to be done. So you want to make sure, and now the official recommendation is to start looking earlier and to treat people earlier. And it also included men this time in the 50 to 69-year-old category. And all men over 70 should be screened. Okay, so we'll talk a little bit about that. I see Monsignor Bennett made it out in the snow. It's always amazing that the man gets here. Monsignor, thanks so much for coming. We appreciate having you there. It gives us a good feeling to see you. Now, the quizmaster came up with a very tough quiz this week. I'm going to give the original way she put it, and then I'll probably have to give some hints as we go on, but you never know with this audience. Dr. Lazaro, this is an amazing audience, you'll see. Which famous tale or story, talking about a little story or a novel, got the name of its setting from an ordinary piece of office furniture? So this is an imaginary setting, I'm going to give you that hint, and it got its name from an ordinary piece of office furniture. We'll talk a little bit about that. We're going to take a short break, and when we come back, we're going to go to your questions. We're going to find out who our first caller is. Is it Maddie? Is it Joel? Is it Grace? Now, our topic, just to remind you, in case you forgot 2 minutes ago, geriatric medicine, internal medicine, chest surgery, general surgery, rheumatology, right? I have like 20 doctors up here, but these doctors are accomplished. They have multiple specialties. The number to call, 718-499-6101, or email your questions to askthedoctor@netny.net. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. Welcome back to Ask the Doctor, where our topics are geriatric medicine, chest surgery, rheumatology, general surgery, internal medicine, you name it, we got it here. Now, we're going to go to our questions. We want to see who our first caller is. Is it Maddie? Is it Joel? Who is that? Hello? Hello?
Hello.
Yes, hi. Who is this, please?
Ivan.
Ivan, is this the first time you've called us?
No, is this Dr. Gardner?
Yes, how are you?
Doctor, how are you? I called you last year with Dr. Morano. I don't know if you remember. My name is not hard to forget.
Ivan, what? Yes.
Okay.
Yes.
Hi, Dr.
I thought we had you banned from the show, but I don't know. Somehow you got through again, Ivan. I don't know what happened.
Okay, could I
Ivan,
ask?
where are you calling us from?
Midwood.
Oh, not far from here.
No, not far.
So what happened to when they used to be? I just got to ask quickly. On Avenue M, there was a restaurant there. What was that?
Yeah, that was
Caravel.
Caravel, yeah.
What happened to that?
They closed up.
Anything there in its place?
No, I haven't been in that area in a long, long time.
No. Anyway, I missed that place. It was a good place. Caravel.
Yeah.
Yes.
What can we do for you?
Okay, Dr. Gardner, my sister and I have been going to a pain management, and, I have lumbar problems, pins and needles in the legs. They say it's coming from the lumbar, the compression of the L4, L5. My sister also has back problems also from the lumbar, and also both of us have the neck, arthritis on the neck. We need to see a very, very good pain management. Of course, as you know, a lot of my, we need somebody that's going to take various kinds of insurances, because I'm having a trouble of locating somebody, of course, with my insurance, and somebody that is very good instead of just, picking a name out of a phone book, somebody that I could get recommended by.
Okay, so first of all, for pain management, I was going to ask Dr. Garner, you see a lot of these type patients. What do you recommend?
I think, well, I can give a name. It's someone who was on the panel with me once previously. I think it's Dr. Hedniati is the pain management specialist at Methodist. He's an excellent doctor. We sent a number of our patients to him, and I highly recommend him. Hopefully he'll accept your insurance.
Okay, what is his name again?
Call back after the show, and we're going to give you his name because he's been on a previous show. We're going to give you his phone number. Okay? So if you can actually hang on, and we're going to have someone take care of that for you.
Thank you.
Ivan, nice to hear from you.
I'll call you tomorrow.
Take care. Thank God for caller ID. Okay. Hi, Myra.
Yes.
How are you?
I'm not so good tonight.
No, where are you calling us from first?
I'm calling from the Brownsville section of Brooklyn.
I picked up that accent. I knew I was going to guess Brownsville. How are you doing?
So-so.
Now, well, can any of our panel help you?
Well, a little over a month ago, my taste buds started changing. I'm a woman of 255 pounds. My taste buds started changing. Nothing seemed to taste right. Now, today, I have little or no appetite. I force myself to eat because I'm diabetic and I'm on pills, so I have to eat to, regulate my sugar. I was at my doctor today, and he said he felt it had a lot to do with...
Did you lose weight since this taste bud problem?
I think I have lost.
Okay, we want to check that out. I want to go to Dr. Katsina on this one and figure out, the taste buds are going. Is that related to diabetes? What's going on?
Okay.
It's an excellent question, Myra.
Uh-huh.
And it's it's an interesting problem. There is a number of conditions that can be associated with that taste change. What exactly do you feel? Do you feel that your taste has changed, or you're not able to taste certain tastes like a sour or bitter or sweet?
The only thing that I'm not able to taste, my mouth becomes very sensitive with spicy foods. But it's just that I don't feel to eat anything.
Yeah.
And when I do eat, I feel nauseous.
Okay, yeah.
And my doctor said today, he says, well, Miss Lewis, he says, I've been observing you as we talked. He says, and physically you seem okay, but yet I mean, you know your body. I know that something is definitely wrong. My mouth is dry.
I see. Okay, Myra, and just tell me how long you've been having the problem?
I'm going to say a month.
About a month?
But other things are going on in my body. In fact, I'm coming to Methodist Hospital on the 31st of this month. I have to have a biopsy.
What kind of a biopsy?
Okay, I hope I'm pronouncing this right. My endometrial wall.
Endometrial wall?
Yes,
Okay.
They have thickened, so we have to do a biopsy.
Can I make a suggestion? Because it's could be so many things, and it could be associated with loss of smell as well as loss of taste. I think this is the kind of thing we suggest you make an appointment to follow up. You could follow up with one of our doctors because you need to do a full exam to see.
Oh, okay.
It may not just, maybe the problem manifests in the taste buds and the sense of smell, but there may be areas of the body where there could be something going on. So again, we're going to give you the numbers on the screen. If you don't, we can help you find a doctor to go and see, okay?
Okay, then.
Nice to hear from you, Myra.
Okay.
Good to talk. We're going to get to Joyce in a second. I just wanted to ask Dr. Lazaro, because I think a lot of people out here, we haven't really had chest surgeons on. Just explain some of the things you do. What does that mean as a chest surgeon?
Thoracic surgery is any type of disease that's within the chest, whether it's heart, lung, esophagus, or maybe abnormalities of some of the glands within the chest. Most of the patients that we take care of tend to be adults. Many of the diseases in the chest are usually related to smoking. And we know that, we're 100 million more people in our population than we anticipated. So there's 300 million people in the United States. The population over the age of 65 is doubling. Many of these people are going to have not only heart disease, but they'll have lung disease, maybe swallowing disorders. Maybe they'll have, unfortunately, emphysema or cancers of the lung or the esophagus. So we evaluate those problems and generally will operate on them when we can cure them.
Very good. And we're going to get in. I know we have a robot at the hospital. I want to get into that in a little while, what that means. But let's go now to Joyce. Hi, Joyce.
Hi.
How are you doing? Where are you calling us from?
I'm calling from Bed-Stuy, Brooklyn.
Bed-Stuy. How are things out there tonight?
Oh, well, I haven't been out for the last 2 days.
It's so bad, this weather, the slush and stuff. It's like one after another.
Yes.
So what are you doing? You're cooking good meals in the house, or you're ordering in?
I cook most of the time in the house.
That's good. What's your favorite meal to cook if we were to come by?
If you were to come by, I would make spare ribs.
Oh, Dr. Lazaro, I see he's licking his lips over here. That's great. What can we do for you?
Okay, I have sarcoidosis. And right now, I have a Pseudomonas infection.
Okay.
I went to the doctor, and she gave me anthromycin.
Okay.
3 pills, and to take it 3 days. But I still have the cough, and the cough gets worse at night and early in the morning when I get up.
Okay, so let's see. We had a patient with pneumonia, some kind of infection, given erythromycin.
Pseudomycin.
I think you have sarcoidosis, you
Yes.
said? Well, sarcoidosis, for the audience, is what we call a granulomatous disease. It's a disease where you get these small conflagrations called granulomas, usually affecting the lung, although it can affect anywhere in the body.
I know.
And thank God, in most cases, it's usually self-limited, but it can present with lung problems such as a cough. How long ago were you diagnosed with the sarcoidosis?
Oh, like 20-some years ago.
And does it flare frequently, or has it gone away and come back?
No, it's always been, and I always be on prednisone. Right now, I'm on a half a pill of 5 milligrams a day.
Well, one of the interesting things is you're telling us that the cough occurs at night and in the morning, and quite often those kinds of coughs have nothing to do with sarcoidosis. It may in fact be an allergy, something in your bedroom, such as dust mites in the bed, which are very frequent, and even the cleanest patient in the world can have dust mites which he or she has an allergy to. So I think the best bet is to go back to the doctor who's treating the sarcoidosis. If it's a pulmonologist, you want to investigate with him or with her other causes of cough which can occur more during the night and in the morning hours.
She told me that it's coming from COPD. I have COPD also.
Okay, well, that's certainly a possibility. Again, we can't comment on any one particular case. COPD is chronic obstructive lung disease. Were you a cigarette smoker?
Never. Never smoke, never drink.
Well, you may want to get a second opinion, or you may want to delve into this more deeply with your physician and ask how he or she arrived at that diagnosis.
Thank you so much for the call, and we'll talk to you. Maybe next week you give us a call back and tell us how you're doing?
Yes, I will.
Thanks a lot. Let's go to an email question. I see the emails are coming in hot and heavy here. I had an episode of atrial fibrillation. Now, this is from Anna in Brooklyn. It was converted after an IV injection of calcium channel blockers. I've not had another episode since. A week after the episode, I wore a Holter monitor, and the doctor said my heart palpitated due to something in the ventricles. I've since experienced those palpitations, and sometimes they are followed by rapid heartbeat, up to 100 beats per minute, and it could last 20 to 25 minutes. My cardiologist does not think I should be concerned. Should I see an electrophysiologist? Thank you, Anna. We don't have a age, but Dr. Kutsina, what do you think about this atrial fibrillation and then ventricular beats that aren't right?
I see. So the atrial fibrillation is an irregular heartbeat. Your ventricular, your palpitations that coming from the ventricle, it may be just the extra beats that coming from the ventricle, but it also could be something more serious, something that is called ventricular tachycardia. I think what you should do is that you should go back to the cardiologist, discuss the results of the Holter monitor with him, and just address the problem, because it's it could be something as simple as just premature ventricular beats, and you should not. This is something that may cause some discomfort, but you should not worry about that. However, it's possible that it's something more serious, and again, I just want to recommend that you go back to your cardiologist and discuss the Holter monitor results.
Thank you. Thanks for that answer. And what we're going to do now is we got Larry on. Larry's going to come on, and then we're going to go to break. And when we come back, we're going to hear from Dr. Lazaro regarding the robot surgery and some of the exciting things you've been doing. Okay?
Thank you.
So let's go to Larry now. Hi, Larry.
Hi, how are you?
Is this our Larry from Rockland County?
This is Larry from Rockland County.
On the computer, watches it almost every time, every week. We missed you last week.
Yes, yes. Unfortunately, something intruded. But you're all to be congratulated for getting to the studio today, because the weather is absolutely horrible up here. I don't know how it is in the Brooklyn, but your previous caller just scooped me on the atrial fibrillation. I wanted to ask Dr. Kutsina if this is, from what I understand, an electrical problem. Why do they want to give you warfarin or this Coumadin, where you have to take all that stuff? And I think several broadcasts ago, you mentioned there's a new product out that you don't have to have blood tests all the time with this stuff.
I see. Okay, this is an excellent question, Larry. So the danger of the atrial fibrillation is that it predisposes patients to the strokes. So it's basically somebody with an atrial fibrillation has a 5 times greater chance of a stroke than a person without the atrial fibrillation. There are certain factors that predispose to the stroke more, and this is something: the age, more than 75, diabetes, hypertension, heart failure, and a history of stroke. So if somebody has 2 or more of those factors, there definitely should be on Coumadin unless there is some serious contraindication. Now, there is a new pill that is called dabigatran, so which is, I think it's a great, it's amazing because you'll have to take the medication twice a day at a set dose, and you should not check your Coumadin level. And I think this is, this is an amazing invention. Yeah, so this is, now, did I answer your questions, or you have something more to clarify?
You did, and what is the name of the drug again?
It's called, the pharmacological name is dabigatran.
Does it have a name yet?
I think it's what is it, Pradaxa? No, it's a Pradaxa, or the pharmacological name is dabigatran. Dabigatran, right.
Okay, and you don't have to have any blood tests at all. And
yes.
It's not contraindicated with any other medications?
Yeah, so before you take any medicine, you'll have to discuss with your doctor if there are any interactions between that medicine or any medications that you've been taking. There is certain way that you should be taken off the Coumadin and placed on dabigatran. The only, in the studies, which was noticed, though, it's in dabigatran, there is a little bit of a higher risk of a significant gastrointestinal bleeding. So this is, that's why discuss it with your doctor, and, you'll be able to get the best care
Thanks,
possible.
Larry. Appreciate the call.
Okay, thank you very much.
Give us a call back next week, please.
Right, and drive home safely, people.
Okay. Now, before we get to this robot thing after the break, let's go over the quiz one more time. Which famous tale got its name of its setting from an ordinary piece of office furniture? I have to give a little hint. There's something written on the furniture that gave the idea to this person who wrote this one of the most famous plays, musicals of all time. Okay, so we're going to take a short break, and when we come back, we're going to be talking about geriatric medicine, chest surgery, general surgery, rheumatology, and internal medicine. The number to call is 718-499-6101. Be patient, it's busy, but we're going to get to you. And the email is to askthedoctor@netny.net. Don't go away. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. And welcome back to Ask the Doctor, where our topics are geriatric medicine, chest surgery, and rheumatology. I have with me Dr. Margarita Kutsina, geriatric medicine and internal medicine attending at the New York Methodist Hospital, Dr. Rich Lazaro, chief of thoracic surgery at New York Methodist Hospital, and Dr. Bruce Garner, chief of rheumatology at the Lutheran Medical Center. Now, I promise we're going to get to Dr. Lazaro. I want to hear a little bit about robot surgery and also minimally invasive surgery. Can you tell us what that is and why it's important?
Absolutely. When I started training in 1988, the first 3 years of surgery was all open surgery, traditionally what we've done for several hundred years. And we fought a battle, I would say, in the 90s to demonstrate that minimally invasive surgery, which is we avoid any big incisions in the abdomen or the chest, and we make keyhole incisions, put a TV camera inside a patient, and be able to perform the same operations with these small incisions, that we could do it as safely. And it took us about a decade to prove that removing a gallbladder, an appendix, a stomach, or even a lung could be done as safely. And always you would hear, okay, I can do it with less pain, I can do it with a person returning to their family earlier. We're not disrupting their lives, we're getting them back to where they belong. And during that period of time, it was always nice to say, I can do it with less pain, I can make you feel better. And we had to prove that short term, if we were doing a big cancer operation and we were doing it through small incisions, that we could do the same operation short term, which meant we took out the same number of lymph nodes, we removed the tumor with what we call the same margins, and we did it with the same safety. It was as good as. But it turns out that when we do things minimally invasive, we're able to preserve the person, the patient's natural defense mechanisms better.
Amazing.
And 5 years down the road, we're seeing that some of our cancer cases are actually doing 25% better survivals.
Amazing.
All because we embraced minimally invasive.
It's amazing. And how does the robot come in?
So the robot comes in terms of we're still doing minimally invasive, but as surgeons, we spend our careers always fighting with administrators, give us the best tool, give us the newest TV monitor. And the robot is $2.5 million thoracoscopic, laparoscopic, minimally invasive instrument. So if I'm dissecting a cancer off the pulmonary artery, I can adjust the pitch of the robot so that if I move 3 millimeters, the robot moves a millimeter. So I can be 3 times more precise when I'm taking out a cancer. So I think it allows me to be a better minimally invasive surgeon.
I hope nobody's got cancer out there, but if you do have lung cancer or other surgery of the lung, this is the man to see, and this is the equipment that you want to have. So, any name to that robot? Or you didn't?
The Da Vinci system.
No, you didn't give him like a little nickname or something, like Sparky or something like that? No? Okay, let's go to Joan on line 1. Hey, Joan.
Hello?
Hi, where are you calling us from?
Who's this?
Oh, I think it's the wrong number. I'm sorry.
I'm calling the doctors.
This is Dr. Garner. How are you?
Dr. Garner.
Oh, it's good to hear.
Doctor, I'm fine. Am I on now?
Yes. What?
Okay, doctor, I'm calling from Bensonhurst.
Oh, one of my favorite areas of the city.
And I'm going to tell you, we ate in the 3-star restaurant.
Oh, George and Jimmy.
That's right. And the best restaurant to eat is on Smith Street, Vinny's.
Vinny's? I don't know Vinny's. Do you know anybody know Vinny's? Oh.
Smith Street is
what is it?
The best.
Italian place?
Yes.
Took a guess.
And my doctor, I wanted to tell you that my friend went to your brother's. He has arthritis, Greg Rapasada, and he's doing fantastic.
Oh, great. Do you know that, Ray?
Yeah, we were just about to send the bill to collection, so no, I'm kidding. Very
and
nice
I want to
gentleman.
tell you, doctor, 4 years ago I had ductal carcinoma.
Ah, how are you doing?
I'm doing fine.
Beautiful.
Dr. Keogh did the surgery, and now I want to know, I do my follow-ups, but I do not go for all the tests, all like bone scans and all that.
Okay, maybe the doctor didn't think it was necessary.
No, they tell me to go, but I don't think it's necessary.
Well, you're doing well, right?
Yes, doctor.
It's always good to listen to the doctor, but, you know, some doctors follow it up more than others. Some do get PET scans and all these tests, and others gauge it by a clinical picture. So it depends upon your doctor. Okay,
and I also have a mitral valve prolapse with a slight murmur.
Right, and a lot of people have, we know a lot of people have that. We know sometimes it's even overdiagnosed at times, but if not significant other than getting antibiotics before you go for certain procedures and so on, and that's also controversial.
Okay.
So that shouldn't be a problem.
Okay.
Joan, it's great to hear from you.
And thank you very much, and don't forget Vinny's.
Vinny's, we're going to Vinny's this weekend now. I'm going to go.
You have to go.
So who do I mention? Do I say Joan sent me? What do I do?
No, you just go in. I'm telling you, it's reasonable, and you get a lot for your money,
That's
and
great.
it's the best.
We're looking forward to it, Joan. Thanks a lot.
Okay.
Take care. Let's go to Sharon. Hi, Sharon.
Hello.
Hi, Sharon. Where are you calling us from?
Crown Heights.
Where? The
Crown Heights.
Crown Heights. Crown Heights. Very
Yeah.
nice. Again, no restaurants in Crown Heights, right?
No, not
No.
much, just Jamaicans.
What can we do for you?
Okay, I have a problem. I don't know if you can help me.
Let's try.
I had a blood clot like 9 years ago when I was pregnant.
I'm sorry. Can it?
Blood clot where?
9 years
When
ago
she was
in my
pregnant?
left leg. In my left leg.
In the leg. She had a blood clot when she was pregnant. Okay.
And then this November, I developed another one in the same leg.
Okay. And another one in the same leg. So recurrent,
Yeah.
we call it clots or deep venous thrombosis. Anybody want to jump on that one?
And Sharon, what is exactly the question? What would you like to ask?
Yeah, so I'm on Coumadin. I'm on Coumadin since November 1st.
Okay. So let's talk a little bit about the likelihood of recurrent clots and Coumadin.
You know, the first blood clot that you've had occurred when you were pregnant, and a pregnancy is a well-known risk factor for the blood clot. Now, we usually give the patient the Coumadin for about 6 months, and then after you're off the Coumadin, we'll decide. Some doctors do the studies to find out why you developed the clot in the first place, but some doctors, in view of your risk factors of being pregnant, just decided to, not to pursue any further. But now that you've developed a second clot, there is apparently something is going on, and your blood is thicker than normally is. So you do have the tendency to develop the blood clots. What I think you should do is just please follow up with your doctor and ask the doctor to order certain blood tests to investigate why you're developing the blood clots. Now, did your doctor tell you how long you have to be on Coumadin? Sharon?
No.
And how long you've been on?
No, he didn't tell me. I'm still on it now, and it's...
Usually when there is a recurrent blood clot, most of the doctors keep the patients on Coumadin, for a very, very long time, maybe lifelong. So please follow up with your doctor and ask the doctor to order certain blood tests to find out why you're developing the blood clots.
Thank you very much. Thanks for the call. Let's go to Ann now. Hi, Anna.
Hello.
Hi, Ann. Could you turn down the TV a little bit?
Yes, I have to put it lower.
Okay, what can we do for you?
Okay, I've been taking Diavan for quite a while, and now on television tonight I heard, and I'm really upset about it, it causes heart attack or stroke.
Again, I think very rare. Diavan is one of the most commonly used pills. Anybody in the panel hear any problems?
With the Diavan?
Yeah.
There is, honestly, I haven't heard the Diavan related to increasing the chances of your heart attack. There are some studies showing that Diavan and some similar medications, of that class, they are associated with an increased risk of cancer. So, but again, before you discontinue that medicine, or stop taking the medications or do anything, please speak to your doctor, because there is a number of medications that you can take for your blood pressure. Right. And if there are any concern with the Diavan, please discuss it with your doctor, and he'll be or she'll be able to give you.
But many people are taking Diavan. The bottom line is that, like Dr. Kucina said, do not stop it suddenly, and it sounds like a rare thing. I haven't heard about it.
It is a very common medication, but again, please speak to your doctor, and if you are to stop it, discuss it with him.
I'm taking a combination of other pills, and I did have breast cancer, and I hope it wasn't because of the Diavan that caused. You said it does promote cancer.
No, there are some studies that show somewhat increased risk of cancer. I think they report the lung cancer being the higher chance, but they do not report any increased morbidity or mortality. So they did not report that people die of more frequently. People taking Diavan, that people not taking Diavan. But again, it's very dangerous to stop your blood pressure medication abruptly. Please speak to your doctor.
We probably think he's going to continue it. Okay, so don't worry about it.
Okay.
Okay. Take care. Take care. Now. Lysandra, how are you?
Fine, thank you.
Hi, where are you calling us from, Lysandra?
I'm calling from East New York, Brooklyn.
East New York. What can we do for you?
My question is, I was diagnosed on Sunday with an ovarian cyst. Now, I'm 38 years old, never had any problems with my ovaries, and also I was diagnosed with a UTI. Now, my question is, they gave me the antibiotic ciprofloxacin. Never heard of it, and I just wanted to know which one was it for? Was it for the UTI or for the cyst?
Okay.
What antibiotic?
Cipro.
Cipro?
Ciprofloxacin.
Ciprofloxacin. All right. So, if you do have an ovarian cyst, it's something different that the gynecologist will probably order the repeat sonogram after your periods. And then depending on what it shows, they will decide what's the best way to proceed. It's never treated with the ciprofloxacin, so I assume if you are given antibiotics, so you probably had the urinary tract infection.
Thank you very much. Okay?
Thank you so much.
Hope that helped you. I want to go over the quiz one more time because I want to give a chance. This was something in the room where he was working on a file cabinet. And it was the two letters on the file cabinet that got this name. So it's a two-letter land or imaginary place in this play that was written on a file cabinet. So if you could tell us the name of this land in 2 letters, and remember it's on letters on a file cabinet.
OZ. Oh.
Whoa, and Dr. Lazzaro, he said, I think he said OG, right? OG, he got exclaimed about that. So
that's awesome.
Anyway, let's do this. Let's take a little short break, because after that I'm a little bit out of breath here. And we're going to see if anybody's got the answer. And I think our producers are not going to let me take a break. This is slave labor, folks. You know, no matter how tired you are, you're not going to get a break. So we'll go to Rose then. Hi, Rose.
Hi, my
They
name is
wouldn't let me. I
Rose.
wanted to take a break, Rose. They said, no, I got to talk to you.
Okay, you talking to me now?
I'm talking to you.
Okay, good. My name is Rose, but I'm calling about my sister. I live in Flatbush,
Okay.
and I'm calling about my sister. She's 66, almost 67 in May. She keeps hearing voices. What kind of doctor should I seek out for her?
Okay, she's hearing voices that aren't there?
Yeah, they're not there. They're not there.
So we need to go to a psychiatrist with her.
That's where I should go?
Right, she may have schizophrenia, and it can be treated today, but we need to get her in.
Okay, so I should go seek a psychiatrist, right?
Yes. Okay,
Yeah, I think, Rose, also you'll have to hurry up and speak to your sister what voices tell her to do, because sometimes it can be, some voices can tell the patient, go kill herself or kill somebody else. So you'll please ask her if she's hearing, if, any voices are threatening her or telling her to do something that is, killing or hurting someone. And if this is what it is, it's maybe you should even call 911. If she is to tell you that, she's gonna, she's been told to kill someone, this is, you have to take it seriously and, see the doctor immediately.
Okay.
I hope that helps, Rose, okay?
Thank you, thank you.
Be well. What we're going to do now, my agents have negotiated a break at this time. We are having a break. Remember the quiz? As he said, OG, he got exclaimed. Remember, there's 2 letters, OG, okay? And let's take a short break, and when we come back, we'll be talking about all these types of medicine that we've been talking about. The number is 718-499-6101, and the email is askthedoctor@netny.net. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. Welcome back to Ask the Doctor. Topics are geriatric medicine, chest surgery, rheumatology, and internal medicine. Remember the quiz, which famous tale got its name from the setting of an ordinary piece of office furniture? Remember, 2 letters, the answer is, and it's on a filing cabinet. Now let's go to our questions. We have Annette on line 2. Hi, Annette.
Yes, hi, how are you?
What can we do for you tonight?
Okay, a couple of years ago I had an operation, a hysterectomy, and the doctor said he had to separate the uterus was taken out from the bladder. When he did that, now I'm incontinent. I can't hold my water. What do you suggest that I do about that?
Dr. Lazzaro, in your surgery days, what do you think about this?
It's there's a whole field of medicine called pelvic floor disorders, and this type of incontinence can sometimes happen from just simple stress. You cough and you become incontinent of the urine, or you even laugh, and it can be very, very disabling socially. So there are studies that can be done to measure your ability to control pressure, and sometimes procedures to be done to enhance the competency, which means how do you control your bladder function? And so there are surgical procedures. There are some experts over at Methodist in the field of gynecology that actually specialize in incontinence after surgical procedures, or even after, a person who's gone through many spontaneous vaginal deliveries. When you've had 4, 5, 6 kids, you tend to get the same problem. So it can be fixed, which is a good thing, but you need to have the appropriate workup.
Thanks a lot. Does that help you, Annette?
Yes, it does. Thank you very much.
Be well. Hi, Shirley.
Yes, good night, doctor.
Shirley, how are you doing? Where are you calling us from?
I'm calling from Crown Heights.
Okay, what can we do for you?
Well, I'm very interested. I want to find out when you have a thyroid. I have a thyroid problem, and I find that I'm losing weight.
Okay. Dr. Cassini, you want to take the thyroid question? What about thyroid problems?
Thyroid, how old are you?
I'm 73 years.
73, okay. So, I mean, it's, of course, as people get older, thyroid problems become more common. Now, there is, somebody can have low thyroid function and or have increased thyroid function. If somebody is losing weight, so most likely, if there is a thyroid problem, it's probably an increased thyroid function. In order to find out what exactly that you have, there is a special, very simple test that can be done at your doctor's office. And depending on what the test shows, the doctor will order the appropriate testing, some sonograms, maybe nuclear studies, and and a follow-up according to your problem.
Any other comments on thyroid?
No, sometimes from a surgical standpoint, when I hear about a thyroid, I tend to also want to find out if you have any difficulty breathing, like you feel you're becoming more short of breath.
No, I don't have any of those.
And any other swallowing?
What the doctor said is that he's seen something over the throat, over the thyroid.
Sure, I think that the blood tests and sonography and ultrasound of the thyroid are the first two ways to start, and I think that's an appropriate way to go. Usually a head and neck surgeon, ear, nose, and throat doctor, or an endocrinologist would be, a specialist for that beyond your internist.
Yes.
Anything, Bruce, to add to this?
I just wanted to make sure I could still hear my voice. I feel like Hop on Walks tonight, but go ahead. No, nothing to add.
Okay, thanks a lot.
Okay, thank you.
Take care. We're now going to go to Angelo, who may have the answer to the quiz. Hi, Angelo.
How you doing?
Okay, I want you to step back now. We don't have the sound effects today, but I understand you might have the answer to the quiz.
Yeah, well, to thank Dr. Lazaro, I think it might be the Wizard of Oz.
Is it the Wizard of Oz? It is the Wizard of Oz. Tremendous. I don't even know how you got that. Thanks a lot, Rich. I don't know how you got that. But we give you a round of applause and your honesty. And
thank you very much.
Do you have a place picked out for this plaque?
Yeah, actually right over my fireplace.
Right over not in the fireplace.
No, not in the fireplace.
A lot of people have done that. But you're going to love this handmade plaque. You know where it's made?
Hopefully Italy?
No, Japan. But they're doing good work in Japan now. Look at the Hyundai. So.
Yeah?
No, where's that? I don't even
Korea,
know. Korea, sorry. But they make good cars. So we hope you're going to enjoy it. We're going to get it out to you freight. You should get it by next week.
Will do. Thank you very much.
Thanks a lot. Take care. Let's go to Eileen. Hi, Eileen.
Hello. I just saw this. I'm looking at this program.
Yes?
And I have a question.
Okay, we're ready for it. Let's go.
Oh, you're ready for it?
Yes.
Okay. I'm 85. Should I leave the TV on?
No, take it off.
Take it off.
What channel are you watching?
What channel?
I don't know. She's watching another station.
Let me take a look.
I don't know.
I didn't even know it existed.
Yeah, turn it off. It's a good idea.
Yeah,
the American Idol's not on tonight if you're looking for it, Eileen.
What's that?
The American Idol's not on tonight.
They are on Ask the Doctor, 97.
97, not 98. 98's the Playboy channel.
No, 97.
So, for those who are tuning in, yes.
So turn it off anyway?
Yeah, turn it off. Give us a shot. Let's see what happens.
Oh, okay.
Okay.
Well, I have problems with, how old am I? He mentioned geriatric medicine.
Yes.
And and it's a 718 number. I live in Queens, 718.
All right.
Also.
You got your own show going on here, Eileen. Let's get to that question.
The question is, I'm pretty healthy. However, I can't even get the TV off.
I'll tell you, we're aging during this conversation. I got to bring a razor next time to shave.
It's my head that's giving me trouble.
Your head?
Yes. I get nervous and I get upset. And
what happens with your head?
She gets pain.
My head, the top of my head hurts, but that's not what bothers me. It bothers me that I get very nervous. When I can't cope, I get very, very nervous.
Mm-hmm.
She can't cope. She gets nervous, headaches.
Yeah, and the headache isn't so bad.
But you're 85 years old.
I'm 85 years old.
And look how you got through. Nobody else can get through on the phone. So
what do you mean?
Uh-huh. Okay, Eileen, I think it's, maybe if you develop headache when you get nervous, it's possible that your blood pressure goes up, and
Yeah.
that's why you're experiencing headache. Have you been taking any medications
Well,
at
I
all?
just got something. I don't know the name. I don't have it right with me. It's twice a day. It's not a very strong medicine.
Okay, so when you regularly see your doctor, please mention that headache that occur while you get excited or worried, and check what your blood pressure is like,
Well,
and
the
maybe
blood
the
pressure
doctor will
was-
have to
but-
change the medicines for you.
I'm sorry. Oh, it can change because the blood pressure was really pretty good. He's not a special geriatric doctor. He's my regular doctor had for a long time. And
Well, we think it's a good idea to see. Like for a pediatrician, you wouldn't take a child to an
well,
internist.
that's what I mean. I could use. Do you give references in the neighborhood?
Well, we can give you some references. One of our doctors has a special category, a computer. That Tara Khan, she was on our show.
Well, I don't have a computer.
You know what you do? If you hang on the phone, we're going to give you some references, okay?
Okay, good.
Thanks, Eileen. Great to hear from you.
Thanks.
Hi, Jay. How are you?
Oh, hello, doctor. Dr. Garner?
Yes, hi. Is this Jay?
Yeah, Gay.
How do you spell that?
G-A-Y.
G-A-Y. Oh, did you call last week?
Yes. Well,
I
2
remember.
weeks ago, I think. Yes.
So just restate the problem.
Oh, well, I had, excuse me, very bad arthritis in my knees, but then my hip got bad, and I had to have hip replacement surgery. Now they tell me I have little or no cartilage in my knees, and I have to have knee replacement surgery. I wanted to know if it's recommended to have both knees done at the same time or one, each time.
Well, it's very rare that they do both knees at the same time, simply because it's a painful procedure. And if you're the type of patient who doesn't want to go through a painful procedure twice and is willing to do what is very difficult and hard rehab, you're motivated to do it immediately after the surgery, they might do both knees at the same time. It's basically an individual decision. It sounds like you do have very bad arthritis. How did the hip surgery go?
Very well.
Well, I think it's something to discuss with the doctor. If he feels both knees or she feels both knees should be done at the same time, it's certainly an option, and this way you'd only have one hospitalization.
Oh, I see.
So, Gay, does that help you?
Yes, that's fine.
Okay, very good. What about one of our callers last week asked about gel they're putting into the disc space in between the vertebral bodies.
Right.
Are you familiar with that?
Yes, I am. And they're giving that for back problems, obviously in between the vertebral bodies. The jury is still out. It's relatively new. Within the past few years, they've been doing it. It seems to be effective, and we'll wait and see. It can be given in very certain circumstances for back
Interesting. I know we
problems.
promised we'd get to one of our callers from last week. We're now going to go to Catherine, who's been waiting patiently. Hi, Catherine.
Yeah.
Where are you calling? Can you talk up a little bit, Catherine? We can't hear you.
Okay, I'm calling from Crown Heights.
Crown Heights. Again, no restaurants, right, in Crown Heights. We have so many callers, but what do you think? What type of restaurant would do well there?
What did you say, sir?
If we were to put a restaurant in Crown Heights, what type would be the best? French, Italian, vegetarian?
Vegetarian would be best, I think.
I think so.
Yeah.
I think that'd be a good idea. For some of that neighborhood just does not have the backup, right?
Right.
So what can we do for you?
Okay, now I have a problem concerning burping. Now, every
Burping.
time, burp. Every time I
You get
eat,
everything. You never know what you're going to get.
yeah, every time I eat, I burp constantly, and I really want to know what's causing that. So that is my question.
I mean,
Burp very
sometimes,
loudly.
I don't know, Rich, you want to grab that one?
Sure. It sounds like you have some form of heartburn or reflux disease, and usually belching is a variant of what you see on TV, gastroesophageal reflux disease, and most of the time that's from air that you swallow. But sometimes the biggest reason for that is that you may be a smoker, you may be on some medications that will make your esophagus a little bit weaker. Sometimes blood pressure medications can do that. Sometimes being overweight, just by a little bit, will increase the reflux. But many times a good thorough history and physical, followed by some x-ray studies called an upper GI series. GI stands for gastrointestinal, where you drink some fluid, we take pictures, will be able to tell us if you do have what's called a hiatal hernia that a significant percentage of the population has, and that could be causing your reflux. And many times it can be treated medically, but you definitely need to have it evaluated, because when I hear you belch like that, I wonder if at night when you sleep, do you ever wake up with a coughing sensation or something in the back of your throat, like you're having trouble breathing?
No, once in a while, yeah, that happened to me. Once in a while, I get that kind of symptoms.
Yeah, you really need to have that looked at. It sounds like significant reflux.
But another thing is, if I have time, it's okay. I could go ahead with the other question.
Very quickly, because we're going to go into our rapid fire questions.
I want to know. I had bowel obstruction in 2008, and after I had the bowel obstruction, the burping had stopped, but now it started back again. So I want to know if that is a cause of it.
Are you moving your bowels and passing gas from below?
Sometime I do. Yeah.
Have you had surgery before?
Yeah, I did. I had bowel obstructions, a small surgery.
Is only one operation, or you've had an operation prior to that?
Just one operation.
What they think caused your bowel obstruction? Because that's pretty atypical if you've never had surgery before.
Is that a hernia?
No, I never had a hernia.
Interesting. We're going to try and get to, give us a call back next week, okay?
Okay.
Thank you. Now we're going to go to rapid fire segment because we have only a few minutes left and many, many callers. So let's go to Amina. Hi, Amina. Amina? Amina?
Yeah.
Hi, Amina. Get a little bit closer to the phone. How are you? Amina? See, that's the rapid fire, but she thought you'd pick up and hang up. Let's not. Amina, next time just stay on the phone. We're going to get to you, okay? Thank you. Let's go to Marza on the rapid segment. Hi, Marza.
Yes, this is Marva.
Marza, how are you? This beautiful name.
Yes, thank you.
Where are you calling us from?
East New York.
East New York, and we're in the rapid fire sequence. So you give us a question, we're going to try and answer it quickly.
Yeah, the question that I want to ask is, could you hear me?
Yeah.
Okay, the question I want to
Yes?
The question I want to ask is that I'm taking Plendin, and I'm also taking Thyroxine, and I want to know if it have anything with gum swelling.
With gum swelling. What was the first medication?
The first medication was Pranzin.
Plendin.
Okay.
Marza?
Yes, it's Plendin for high blood pressure.
Okay, Ascendin?
What is the name of that medicine again?
Flopendine.
I can't do rapid fire. I want to do rapid fire.
I cannot get the name of that
What
medication.
About
okay, so blood pressure medicine and thyroid medicine. Can they be causing a gum?
Thyroid medicine is highly unlikely to cause the gum swelling. Some of the medication, some of the blood pressure medication can be associated with that, but just please clarify with your doctor, because for some reason I cannot get that medicine, name that you're taking.
Okay. Now we're going to do our next rapid fire, who's going to be Donna. Hi, Donna.
Hi.
Are you ready for the rapid fire segment?
Yes, I am.
Okay, what's the question?
My question is, I have been diagnosed with rheumatoid arthritis.
Okay.
11 years ago. I'm 50 years old. And my doctor had put me on methotrexate, 7 pills a week.
Talk up a little bit.
Sorry?
Just talk a little louder, that's good.
Oh, yeah. My doctor put me on methotrexate, 7 pills a week. And I find that every time I have a flare-up, the methotrexate doesn't work.
Okay, let's go to Dr. Bruce Garner, rapid fire.
Methotrexate, methotrexate is the most commonly prescribed medication in the world today for rheumatoid arthritis, but sometimes it loses its effect. It sounds as if it may be losing its effect with you. There are other medications one can try. There's a similar medication called Arava or leflunomide, which your doctor may want to try. It works as effectively as methotrexate, and it works particularly well in some patients who don't do well on the methotrexate, or it works together well with the methotrexate.
Donna, hope that helps you. We're now going to Amina. Amina, you're back for rapid fire.
Yes.
What can we do for you?
I had a triple bypass in 2009 May, and I'm getting pain until now and on my chest bone. I don't sleep proper in the night.
Okay.
And I'm drinking a lot of medication they have me on.
Now, your heart operation, was that for chest pain, or you had a heart attack?
I had a triple bypass. I didn't have a heart attack.
Okay, were you getting chest pain prior to your triple bypass?
Yes. It's not chest pain. It's the bone itself is paining me, where they cut me.
Yeah, that needs to be evaluated, because sometimes that breastbone is called your sternum, and occasionally there will be what we call non-healing, where it doesn't heal as properly, and you can have chronic pain from that. and that usually can be identified on a physical exam and some x-ray studies. Needs to be looked at.
Thanks, Amina. Last rapid fire. Joe. Joe.
Yes.
You ready for rapid
I'm calling
fire?
because I'm having problems with my sinuses all the time.
Okay, and you want to get some relief.
I'm a diabetic, and my ENT doctor had suggested I have a deviated septum, and he suggested that maybe I should get an operation.
Okay, let's grab that.
No, I think it's I can do it. So it's probably your deviated septum is contributing to your frequent sinus infections, and it's usually what we usually give some antibiotic or nasal spray for the sinusitis. But if you have it very frequently, it's you cannot be taking antibiotics every couple of weeks. So if your ENT doctor thinks that your deviated septum is contributing to the frequent sinus infections, then I think you should definitely go ahead and do it.
Joe, thanks for joining us. No, we got rapid fired over here. I'm sorry,
Yeah.
because our producer's going like this. We only pay for an hour, so they won't let us go. But that's it for this episode of Ask the Doctor. I want to thank Dr. Margarita Kutsina, Dr. Rich Lazaro, and Dr. Bruce Garner for coming in. We hope we're able to help you. It's good to remember that you should be proactive about your own health. Another show is breaking out here. Speak to your doctors about your concerns. Go for second or third opinions. In the meantime, visit our website at netny.net/askthedoctor. This you can see my video blogs, the tablet column, podcast, forum, send in your quiz, suggestions, and many more. I'm excited about this. You can also watch last week's episodes tonight at 10 p.m. If you didn't have enough last week, watch it tonight at 10. Thanks to Linda Lapatosa, our quiz master. And thank you all for your questions. Next week, we'll be discussing emergency medicine, kidney disease, lung and internal medicine. Goodbye. Stay well, be healthy, and I'll see you in the tablet. Take care.